Okay, Doctor Saab, present your case. Sir, my patient is an elderly lady lying in the bed. She is in distress and she has a staring look. On examination, she has a cachectic look. There is a generalized wasting. On a thyroid examination, on inspection, I found that there is a multinodular goiter, and the biggest nodule is about the biggest. There is one nodule which is bigger in size. There is no redness over it. On palpation, I found that there is a multinodular goiter. It is non-tender. The biggest nodule is about 2 centimeter, and this multinodular goiter is freely mobile over the underlying, and the skin overlying is also mobile. It is not tethered, and there is no tenderness. The lymph nodes are not palpable. And the trachea is central, and on percussion I found that there is retrosternal extension. On auscultation there is no bruise. On further extension of the examination, I found that there is a lid leg and lid retraction, and there is a proptosis. There is no diplopia. The skin of the face it is dry and warm, and the hair are thick. There is proximal myopathy present, and the examination of the hand reveals that there is fine tremor of the outstretched hand, and there is a thyroid acropathy. The clubbing is present. There is primary erythema, but there is no sweating. The pulse is 120 beats per minute, and it is regular. The blood pressure is 160/90, and there is proximal myopathy present. There is no pre-tibial mesoedema, and there is no pedal edema. The reflexes are brisk, and the knee reflex, they are both brisk. The knee reflex is brisk. The precordial examination reveals that apex beat is not displaced, and it is normal correct. The chest auscultation reveals the normal breath sounds. Okay, Dr. Saab, what is your diagnosis? Sir, my diagnosis for this patient is multinodular goiter. The second differential will be toxic nodular goiter. Okay, Dr. Saab, what investigations you will do? Sir, first of all, I will do the thyroid function test, which will show me that TSH will be low and T3, T4 will be increased. Sir, I will also do thyroid scan, thyroid ultrasound scan, which will show me the nodularity, the structure, the nature of the nodularity, whether there is cystic or solid nodules. And after that, I will do the radioiodine scan, which will show me that is there any high uptake of radioiodine or is there low uptake of radioiodine. If there is high uptake of radioiodine, this means it's a warm nodule, and this shows that the toxicosis is there. And if there is a decreased uptake, then this shows that the cold nodule, which is dangerous. Okay, Dr. Saab, if there is cold nodule, then how will you further investigate the patient? Sir, I will then do the fine needle aspiration and biopsy, true cut biopsy, because the radioiodine uptake is low. Then this means that this can be a malignant nodule, so this needs further workup. How will you further investigate this patient? Sir, further I will also do the chest x-ray, which will show the retrosternal extension of the goiter, and also the cardiac shadow, which may be enlarged. The congestive cardiac failure is one of the complications. Also, it will show me about the pleural effusion. I will also do the ECG, which will show me the atrial fibrillation, and also I will do the serum electrolytes, which will show me the hypokalemia. Okay, Dr. Saab, how will you manage this patient? Sir, I will do the multidisciplinary approach. I will also involve the surgeon in it, and also I will involve the endocrinologist, and also I will do the patient education. If the patient is young, less than 40, then I will start on the neomarcazole at a dose of 45 milligram OD. It will it is an anti-thyroid drug, and also I will start with the androl or beta blockers, which will decrease the heart rate. And if the patient is above 40, then the radioiodine is the drug of choice. If the patient is above 40, then I will go for the radioiodine uptake. If the patient is above 40, then I will go for the radioiodine therapy. What are the indications for the surgery in this patient? Sir, the indication for the surgery is if the patient is below the 40 and he or she is not responding to the drug, or there is relapse of the disease, then we will go for the surgery. Thank you.